biohacking implants. So I do a lot of zirconia implants, and I know that it's been looked upon as, do they work and all this stuff? Do they last? Yes, we don't have the long-term data, but I think the issue heals really nicely around them. And if you know what you're doing and you know how to place them, it can work really well. And the thing is, the holistic patients are great patients. There's three types. There's the health person that's just looking for health and they want to stay healthy. And there's the ill person that's looking to try and get better. And then there's a little bit of woo-woo. They're a little sugar, but you got to deal with everything. Here's an example of implant placement. Look how nicely it works out. I do a lot of the SDF implants. This implant is very good for immediate implants. And one of the keys with this implant, it's actually preppable. And so you need to keep enough implant above the gum so that you can get a nice ferrule effect. And so I think that's one of the key things. When I was first starting to use them, I didn't realize how important that was as much. And I did have one or two break off because we were relying on the abutment to hold the crown, and you do not want to do that because that's going to break. That's going to cause failure. Here's some examples of some immediates. Zirconia, the advantages is when you have thin bone, biotite, you don't have that metal show through. The problem is you don't have a lot of angulation change, but these are preppable, so they're like natural tooths. You can make some changes. You don't want to over torque them, that's for sure. Patients that don't want metal, they do ask for this. Titanium definitely is a little bit better for like an all-on-4 full mouth type of procedure. A little easier to make angulation changes, and you can have higher torques with them.